It is no secret that the COVID-19 pandemic has hit Kenya's economy and hit it hard. With it has been hopes that the stringent measures could speed up the eradication of the deadly pandemic. Anita Nkonge explains further.
It's been 1 year and 2 months since the first case of COVID-19 was reported in Kenya. Since then, the country has experienced the worst social and economic impact of the deadly virus due to lockdowns and COVID-19 restrictions. According to a recent survey on financial and social COVID-19 effects published by Geopol, the virus is pushing sub-Saharan Africa's leading economies back into poverty, Kenya included. The study conducted between March 24th to April 12th found that Kenya reported the most widespread fall in Q1 income, with 79% of respondents reporting a fall in income between January and March of 2021. The survey also found that the hardest hit demographic were young people, with 66% of them aged 18 to 25 years reporting a sharp drop in their income in the first quarter of 2021. Kenya is not an exception. Across the continent, 53% of the respondents revealed that they were worried about paying their expenses in the next 3 months. There is another concern that could significantly slow down the end of the COVID-19 pandemic: vaccine nationalism. So far, 1.3 billion COVID-19 vaccines have been administered worldwide. However, 83% have gone to a handful of wealthy nations, while low-income countries across the globe like Kenya own a mere 0.3%. Kenya currently has a few weeks before its share of 1 million COVID-19 vaccines run out. The Ministry of Health had hoped to begin administering the second dose of COVID-19 vaccines through the COVAX initiative by the first week of June. But it is still not clear when vaccines will be available. Stakeholders across the globe have been pushing wealthier nations to share their batches of surplus vaccines.
If vaccines are not actually deployed very quickly, and if a large number of Africans are not vaccinated as soon as possible, we may end up having a situation whereby we'll have new variants that are emerging that may not even respond to all of these vaccines. And that's the reason why we think vaccine nationalism is really not something we should encourage. Countries that are actually stocking vaccines and hoping that, by stocking 10 doses of vaccine for someone that needs only 2, thinking that they are safe, they are really not safe because, look, we're in a global world.
So far, the U.S. has pledged to donate 80 million doses of some of their Pfizer, Moderna, and Johnson & Johnson vaccines. Anita Nkonge, NTV.